doing my IV insertion Checkoff. I don't have a IV kit or anything like that in my bag, so we'll make it work with what we have. First thing you're going to do is verify your orders, gather your supplies, and then you will go in and verify your patient's name, date of birth, any allergies. You will do some hand hygiene, put some gloves on, talk to your patient, figure out which arm works for them better, figure out their dominant versus non-dominant hand, and then once you find a vein that you think will work, you'll apply the tourniquet to that arm in a quick release fashion, and then you'll start feeling for your vein. Once you've found a vein that will work, you'll use your pour prep and you'll scrub for about 30 seconds, minimum of 30 seconds with friction on that spot. Then you let it dry. And then while that's drying, you can go ahead and take your hep lock and all that of the part, go ahead and flush it and get it set up and ready to connect to your IV. And then you can go ahead and have your other saline syringe handy to flush. So once that's done, you'll use your non-dominant hand, which for me is my right, to apply some tension to their arm or wrist. You usually want to start distally, like down at the hand, and then go upwards. You want to go at a 45-degree angle to the skin. When you see flashback in the chamber, you insert the IV, you advance the IV catheter. This isn't an actual IV catheter, so I'm just going to, for reference, use the needle and advance it. At that point, you will release the tourniquet, use my non-dominant hand to apply the pressure, and disconnect the needle from the catheter. Then you'll hook up your lock, you clean the port, and then you put the not having supplies really messes with me. So you've connected that. You'll secure your IV in the fashion that you like. Some people use chevrons, some people just put a piece of tape and then the tegaderm. So you'll put that over it, and then you'll flush and watch for any infiltrate with your 10 milliliters of saline. And if it does infiltrate, then you'll need to start over. If it doesn't, you name and date, initial and date, the time the IV was started, and then you want to document everything that happened.